Scientists from Oxford University are boasting of a breakthrough in the fight against Alzheimer's. And it's not a super expensive new wonder drug. It's the humble bottles of vitamin B supplements already available in our chemist shops.
Vitamins B6, B12 and folic acid have long been considered good for you, but until now their true powers have remained hidden.
It's the first time we have been able to show that a simple drug can slow brain shrinkage.
And that means slowing rapid memory loss, a warning sign of Alzheimer's disease. In the Oxford University trial, half the participants were given vitamin B tablets and the other half placebos. Over 2 years, those who received the fake pill showed evidence their brains had shrunk significantly. Those taking vitamin B suffered much less shrinkage, some by half. John Huff was among them.
I might not have been deteriorating, but you're not aware of deterioration. You'll only be aware if things start improving. My wife thinks I was better, if that's the term.
He's so pleased he'll continue to take his supplements. But the researchers warn self-medicators you can have too much of a good thing.
I certainly wouldn't recommend people to go out and take these mega doses without consulting a doctor.
A longer trial is now underway to determine if vitamin B delays the onset of Alzheimer's, which researchers now dare to believe is the case. In London, Danielle Isdale, 10 News.
Professor Jürgen Getz from the University of Sydney's Brain and Mind Research Institute joins us now live in the studio. Professor, there's an old saying, if things sound too good to be true, they usually are. Is this too good to be true, or do we really have an absolute breakthrough here?
I think it's an interesting study, and it is backed up by two earlier studies from 2007 and 2008, where cognition was addressed, while this study focuses on brain shrinkage.
And is that what we're looking for, to avoid that brain shrinkage?
Yes, brain shrinkage has been correlated with a loss in cognition and also with the development of Alzheimer's disease. And in this study, a group of patients was looked at called mild cognitively impaired, and 50% of this group is known to convert to Alzheimer's disease. I think it's an interesting study also because, nutrition is important, and for example, since September 2009, so since approximately a year, in Australia, flour has to be supplemented by folic acid, and that's one of the vitamins that has been investigated in this study.
It's interesting with this study, though, that it claims that it helps prevent the onset of Alzheimer's. You're talking about diet and things like that. How much does environment contribute to the onset of Alzheimer's?
It contributes a lot. Obviously there's a genetic component, but there's also an environmental component. And I personally would recommend exercise and eating the healthy food provided here in Australia.
There's an old thing about active mind is an important part. Is that really the case?
I would say so. Yeah, this Latin saying, mens sana and corpore sano. So when you have, yes, absolutely. And that's reflected by this study. So I think it's very encouraging. But obviously there's a long way to go. So there's a need for clinical trials. Also, it's a relatively small study size.
The interesting thing about the report we carried earlier, that there were concerns about the use of the vitamin itself. Too much vitamin B clearly is not good for you, and the fact that if people are desperate to avoid or control Alzheimer's, that they'll overdose. How do you go about deciding what's right for you?
That's absolutely correct. Overdosing can be a problem, so it can lead to numbness, to all kinds of problems with memory and attention. So vitamins should not, or some vitamins should not be overdosed. We know of Linus Pauling, a Nobel laureate, who was eating vitamin C, and he became quite old and was still active at a high age. So it's always important to do the proper dosing, and obviously that's a problem.
Now, there's all sorts of vitamin B. There's different groups of vitamin B. Is it the overall vitamin B, or is it a particular combination of vitamin B, or is it combined with some other element that makes it work?
I think that's an interesting question, because in the study they looked at different vitamins. They looked at vitamin B6, B12, and also folic acid, the one component with which flour is supplemented since a year. And it seems as if all vitamin Bs have a positive effect on preventing brain shrinkage.
So we can call this a breakthrough?
I would say so, yes.
Okay, we like that word. Professor Jürgen Getz from the University of Sydney. Thank you very much for coming in and having a chat with us.
It's a pleasure. Thanks.
I feel better now for the future.